Hi, my name is Rebecca Telford. I'm here interviewing Gauz Adlao, the CNO of PHSC Memorial Hospital, and we're going to be talking about one of the medication errors that occurred at his hospital.
All right, so here at PHSC Memorial Hospital, the situation that occurred was that a nurse was not able to distinguish the two vials of heparin and Heplock. However, Baxter Pharmaceuticals, it made the two vials almost identical, and that led to giving a fatal dose of 10,000 units of heparin to these two newborn twins, and that created this crucial medication error event.
Oh, wow. All right. So tell me, what exactly constitutes a medication error?
Well, a medication error is any preventable event that can cause dangerous medication use or endanger a patient's life. Some examples could be giving the wrong medication at the wrong time or route, giving the medication to the wrong patient, and in this case, they were given the wrong dose.
Wow. All right. So why was this particular medication pass classified as an error?
Well, I mean, it was classified as an error because the dose was 1,000 times the prescribed dose, which was 10 units of the Heplock.
Okay.
Mhm.
So how did the error occur? Can you describe the chain of events?
So in this situation, the company Baxter Pharmaceuticals, it was what happened was that they changed the vial packaging
Okay.
for heparin and Heplock
Okay.
so that they didn't look similar, but they failed to recall
Mm.
those old vials from the
Alright.
hospitals, and that led to this medication error that happened at my hospital.
Wow. All right.
Yeah.
So, who exactly is responsible for maintaining safe medication administration?
100%, it's the nurse. So.
All right. So then, what role does the nurse play in preventing medication errors?
Well, they play a major role, and that's by doing their 3 med checks.
Okay. What are those?
Okay, so those 3 med checks, it starts off by just checking the provider's order,
Okay.
and they compare it to the MAR, and then they check it when they pull the medication from the Pyxis, and then the final check happens at the bedside,
Oh, wow.
followed by the 10 medication administration
Wow.
rates.
That sounds like a lot of checks. Like,
Yeah.
I don't understand how this is happening. Can we consider the nurse who made the mistake? Had they shown signs of neglect before?
That's a good question. So, we as a company, we think that the nurse was definitely neglecting their duties in the past, and they've developed some sort of tradition leading into their medication administration process, bad habits, and we believe that she was missing an integral part of that process.
Okay.
So, mhm.
Tell me about the medications that were used during this era. What kind of medication was it, and what type of harm could it potentially do?
So the medication administered was heparin, which is an anticoagulant, and that's typically given for patients experiencing blood clots. However, the prescribed medication was Heplock. It's also heparin, but it's at a much lower dose,
Oh, okay.
about 10 to 100 milligrams. In this case, again, it was 1,000 times that with the normal heparin, and it's the prescribed medication was just used to maintain a patent IV.
Okay.
Because that high dose of heparin received, the infants were placed in an extremely high risk of bleeding out. So if they had any minor harm, they would have bled out
Wow.
extremely.
That is terrifying. So, with that situation, how could the nurse ensure patient safety before and or after the error occurred?
Well, they could have definitely done the 10 medication rights. Those rights that they have to follow are right patient, right route, right dose, right time, right medication, right indication, education, response, right to refuse, right documentation. Those 10 rights.
Wow, those are a lot of
Yeah.
rights. Why is it this important for practicing nurses to do these rights?
Well, this procedure basically helps prevent situations that are very similar to what happened right now at my hospital. So that's basically the reason why. So yeah, with regards, you mentioned after.
Yes, I did.
So the nurse could have assessed those two newborns for any adverse effects, specifically the bleeding.
Yeah.
They could have maybe showed signs of that, maybe through their vitals, so whatnot.
Okay.
So.
All right. What is the procedure when a medication error happens? Like, what does your hospital do?
Well, the first thing that you always want to make sure is that you as a nurse, you have to assess your patient first.
Yes.
That's always a must.
Patient
and
safety.
This basically ensures that they're not having any sort of fatal or adverse side effects.
Okay.
And then after this, the nurse is required to document this as an incident report. So yeah.
All right. So what are the potential risks of a medication error? Because I know these patients in particular did not die, but
patient harm, hypersensitive reactions, and yeah, like what you mentioned, death, possible death. Yeah.
Yes. All right. So what are some medication error risk reduction strategies that could be implemented to keep this from happening again?
So, as a company, we decided that we're planning on mandating that nurses scan their patients' identification wristbands before administering any medications. We'll also be reinforcing the rule of only grabbing one patient's medications from the Pyxis at a time. And then afterwards, we were also planning on giving them maybe teaching classes just to help make sure that they're getting they're doing the 3 checks, doing the 10 rights.
Okay.
Yep.
Those sound very good. Well, thank you for your interview.
Thank you.
I hope everything goes well
Thank you.
in the future.
Thank you so much.
Mm-hmm.